Welcome to this module, which is part of the Trauma-Informed Mental Wellness Professional Development Series. This presentation is made possible by a grant from the National Youth Advocacy and Resilience Research Center at Georgia Southern University. The topic of this presentation is Foundations of Trauma, definitions, sources, and types of trauma, and how trauma affects the brain and body. My name is April Garrity, and I'm a professor in the Department of Clinical Sciences at Georgia Southern University. The learning objectives for Part 1 of the presentation are provided here. Please take a moment to read through them. Ludwig suggests that we must assume there is trauma in our presence. In other words, trauma is so pervasive that we are likely encountering individuals with trauma histories in every context or situation. Trauma can take many forms and stem from many different causes. This presentation will describe different types of traumas and their causes. Let's start by learning the basic definition of trauma. The Substance Abuse and Mental Health Services Administration defines trauma as an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. This definition is fairly broad in scope, so we'll explore different types of traumas that individuals might experience. These are the types of traumas that we'll discuss in this presentation. Adverse childhood experiences, or ACEs, by definition occur prior to the age of 18 and include physical, emotional, or sexual abuse, physical or emotional neglect, or a living situation in which any members of the household were experiencing mental illness, physical abuse, divorce, substance misuse, or incarceration. ACEs are a significant source of trauma, with 61% of adults reporting that they have had at least one ACE, and 16% of those surveyed reporting they had 4 or more ACEs. Acute traumas are typically brief experiences that occur at a specific time, while chronic traumas are those that occur repeatedly over a long period of time. Being involved in a serious car accident could be an example of an acute trauma. Experiencing verbal abuse over a period of months or years could constitute chronic trauma. Complex trauma is caused by multiple, invasive, interpersonal traumatic experiences, typically during the early childhood years and often at the hands of a caregiver. These frequently result in extensive long-term effects. Sometimes we hear traumas categorized as big T or little t. Big T traumas are those that involve dangerous or life-threatening situations such as combat, natural disasters, and assault. Little t traumas are referred to as such because they're typically thought of as non life threatening experiences in and of themselves. However, the effects of repeated little t traumas can be significant. These experiences include microaggressions, stigma, and bullying, and are more prevalent among those who belong to marginalized or minoritized groups. Historical trauma is sometimes referred to as generational trauma. Historical trauma is defined as multi-generational trauma experienced by a specific cultural, racial, or ethnic group. Historical trauma arises from being part of a community that has endured traumatic experiences, such as those whose ancestors were enslaved or forced to move from ancestral lands, or harmed because of their specific religious practices or beliefs. As depicted in this graphic, evidence suggests that historical or generational trauma can be a precursor to ACEs and can have far reaching detrimental effects on psychological and physiological health. Racial trauma is related to historical trauma, but is specific to current experiences of systemic racism and the perceived or real threats of harm based on race. Post-traumatic stress disorder, or PTSD, may be diagnosed when an individual exhibits a cluster of physical, cognitive, and behavioral symptoms following involvement in a dangerous or life-threatening situation, such as combat, natural disaster, or physical assault, including sexual assault. These are sometimes referred to as Criterion A stressors because they are the first of 8 criteria, Criterion A through Criterion H, required for a diagnosis of PTSD. Approximately 10 to 12% of women and 5 to 6% of men will meet criteria for a diagnosis of PTSD in their lifetime. By now, it has probably become clear to you that overlap exists among the different types of trauma and their causes. Here is one more aspect to consider. Is this statement true or false? Two people can experience the same event, and one of those individuals could be traumatized by it while the other is not. The correct answer is true. The reasons for this will be discussed in the next part of this presentation. If you would like a copy of this reference list, please feel free to email me. My email address is at the top of this slide. The topic of part 2 of this presentation is how does trauma affect the brain and body? The learning objectives for part 2 are provided here. Please take a moment to read through them. Trauma survivors may exhibit significant individual variability in terms of their physiological responses to their experiences. In other words, two people can experience the same event, and one of those could be traumatized by it while the other is not. Individuals may experience trauma differently depending on a variety of factors, including previous experiences or strength of coping skills at the time of the stressful event. In other words, an event that causes minor stress for one person could be a traumatic stressor for another. The emotional processing of traumatic experiences appears to depend on individual variables such as resilience and allostatic load, or the cumulative degree to which the nervous system may already be burdened by consequences of previous experiences. In addition, the type and degree of stress-induced changes in the brain, such as the prefrontal cortex and the hippocampus, could be influenced by the neurodevelopmental stage at which traumatic events occur. Physiological changes related to trauma are believed to arise from overactivation of the sympathetic nervous system's fight or flight response to situations that are dangerous or that are perceived as such. As the sympathetic nervous system activates to support survival in the face of an imminent threat, several physiological responses follow. These include decreased blood flow to certain organs, like those of the digestive tract, along with increased blood glucose levels, increased oxygen uptake in the lungs, and increased blood pressure and heart rate. The hypothalamic pituitary adrenal axis, or HPA axis, a circuit that mediates stressors through complex connections among the neurological, endocrine, and immune systems, has significant involvement in the sympathetic nervous system in its role coordinating the physiological responses to danger. Chronic or traumatic stress causes the sympathetic nervous system and the function of the HPA axis to become dysregulated, leaving the neurological, endocrine, and immune systems vulnerable to systemic physiological sequelae. One such consequence includes a systemic inflammatory response, which has been associated with cognitive decline, metabolic disorders such as diabetes, and cardiovascular disease. Research from the late 1990s documented a dose-response relationship among adults who reported experiencing adverse childhood experiences. In other words, a higher number of ACEs was correlated with poorer health outcomes as adults. This graphic, called the ACE pyramid, illustrates what current evidence suggests about the effects of trauma on physiological health. Populations that carry generational or historical trauma are also more likely to experience disparities in their social contexts. This includes social determinants of health, such as employment, racism, access to health care, and access to clean water and nutritious foods. In addition to the physiological stress-induced changes to the brain and body, those with trauma histories are at increased risk for making negative health choices, such as substance misuse, smoking, and engaging in risky sexual behaviors. In addition, trauma survivors are more likely to be diagnosed with mental health disorders, such as depression, anxiety, and suicidal ideation. They are also at heightened risk for infectious diseases, such as sexually transmitted infections and HIV. The presence of all of these factors may contribute to early death. The ACE pyramid shows how trauma can create a vicious cycle of continued struggle for those who are affected. If you would like a copy of this reference list, please feel free to email me. My email address is at the top of this slide. Thank you for participating in this module of the Trauma-Informed Mental Wellness Professional Development Series. We are interested in hearing about your experience and are seeking ways to improve our opportunities to provide professional development on these topics or related topics in the future. If you're willing to participate in a brief survey related to this module, please navigate to our survey using the QR code on this slide.